Alright, friends, before we talk about this disease, let's read a clinical vignette.
A 6-year-old boy with developmental delay and self-injurious behavior. His parents mention he often bites his lips and fingers severely. He shows spasticity and dystonia, especially in his arms. Tests show high uric acid levels in his blood and orange crystals in his urine.
To better understand this medical condition, let's focus on this biochemical pathway. Normally, the nucleic acid inside a normal human being gets converted into simpler forms like guanine and hypoxanthine. Now, this guanine and hypoxanthine has two pathways to go. Number one, it can get converted into uric acid with the help of enzyme xanthine oxidase, or it can be salvaged back to IMP and GMP thanks to this beautiful enzyme HGPRD. Unfortunately, some kids are born with the absence of this enzyme HGPRD, leading to this terrible condition called Lesch syndrome. Now imagine if there is an absence of HGPRD enzyme, which pathway will be working overtime? Correct. So hypoxanthine and guanine will get converted into uric acid over time because one pathway is blocked. So all they have to move on is in the pathway of getting converted into uric acid, leading to high concentration of uric acid, a condition called hyperuricemia. Now, this increased concentration of uric acid will lead to all the problems associated with this condition. Number one, it can pass through urine, leading to the classic red orange sand crystals in the diaper of the kid suffering from Lesch syndrome. Secondly, it can deposit in the joints, leading to gout. And the uric acid may also get deposited into basal ganglia, leading to tense muscles, a condition called dystonia. And some classic findings like aggression and self-mutilation is related with absence of communication skills in these kind of kids. They cannot communicate well because of the deposition of uric acid in the areas of brain. So they get pissed off. They are aggressive. They are self-mutilating. So they usually bite their own fingers and skin. And one classic finding of macrocytosis is observed in Lesch syndrome. Now, there are several reasons why there is macrocytosis. Some researchers have concluded that self-mutilation in these kids leads to chronic blood loss, leading to hyperactivity of the bone marrow, causing macrocytosis. Another hypothesis is that the chronic use of allopurinol in this kind of condition can cause drug-induced macrocytosis. So these are few reasons which can cause macrocytosis in this Nyhan syndrome. All right, let's summarize what we have learned so far. So the main enzyme which is defective or absent in this disease is HGPRD. So there will be defective urine salvage, leading to high PRPP activity, which is the main enzyme involved in purine synthesis. So as the purine salvage will be defective, the purine synthesis will try to compensate, resulting into high PRPP activity. Other features like the patient will be highly pissed, aggressive, biting his own nails and skins, leading to self-mutilation. Uric acid will come out of the urine, leading to the classic orange crystals in the urine. So this orange-like image will remind you of the orange crystals in the urine, which is classic for Lesch syndrome. And this big image showing the orange will also remind you of the big RBC, another term for which is macrocytosis. And the crossed leg will also remind you of the dystonic attitude of the feet as well as X-linked recessive condition. The finger toe, which is big and yellow, will remind you of the gout, and the book falling down will remind you of the intellectual disability exhibited in this disease. All right, friends, thank you for listening me. Try to summarize everything that you learn into a single picture so that you'll never forget anything. Thank you.